So in this video I will like to talk about the muscles of the back, the pectoral region muscles, the scapulohumeral muscles, their attachments, their nerve supply, and some important things about it. So the muscle that you are just seeing, this muscle, this is the trapezius muscle. But this trapezius muscle, it is present on either side. That means it will be like this. But when the shape of the trapezius muscle is asked, it is triangular shaped because we have to take only the half, this region. So this is the trapezius muscle. So from this, the trapezius muscle is originating from the, here you can see this is a superior nuchal line. The medial 1/3, that is this one region, medial 1/3 of the superior nuchal line. This is the external occipital protuberance. It extends down as the ligamentum nuchae. So this is the ligamentum nuchae. It is actually the continuation of the supraspinous ligament. Then you can see that it is originating from the spine of the C7 vertebrae, also from the spine of the, also from the spinous process of the T1 to the T12. That is the entire thoracic vertebrae, spinous process. So this is the origin of the trapezius muscle. That is superior nuchal line, medial 1/3, external occipital protuberance, ligamentum nuchae, then the spine of the C7, then spine of the T1 to T12. So here you can see the superior fibers. Its insertion is, the superior fibers are inserting into the lateral 1/3 of the clavicle. This is actually the scapula, and this is the spine of scapula. The clavicle is in front. Then you can see that the middle fibers, so these are the middle fibers, they run transversely and are inserting into the acromion process as well as the crest of spine. This is the acromion and this is the spine of scapula. So these are the lower fibers which go upwards and laterally, and it gets inserted into this is deltoid tubercle. Deltoid tubercle. So it is called deltoid tubercle because it is giving origin for the deltoid muscle, that is this muscle. It is giving origin to this deltoid muscle, but it is also giving attachment to the trapezius muscle. So coming on to its action, the upper fibers of the trapezius muscle, that is this fibers, as well as the levator scapula, that is this one, it will actually elevate the scapula. It is the muscle is called levator scapula, so it will elevate the scapula and it helps in the shrugging of the shoulder. Whereas the horizontal fibers of the trapezius muscle, that is these fibers, as well as the rhomboid minor muscle and the rhomboid major muscle. So this is a rhomboid minor muscle as well as a rhomboid major muscle. So these two muscles are deep to the trapezius. That means only when the trapezius is reflected we can see those muscles. So this will help in, it will actually help in the retraction of the scapula. That is retraction of the scapula. The lower fibers of the trapezius muscle are responsible for depression of the scapula. So that means upper fibers for elevation, lower fibers for depression, and the horizontal fibers for retraction of scapula. The upper and the lower fibers of the trapezius muscle along with the serratus anterior muscle, so this is that muscle, it will help in rotation of the scapula, which is needed for overhead abduction. Actually the abduction 0 to 15 degree of your abduction is by the supraspinatus. supraspinatus muscle. Then 15 to 90 degrees, it is by the middle fibers of the deltoid muscle. So beyond the 90-degree, this is called overhead abduction. Overhead abduction. So here a rotation of scapula is needed. The scapula must be rotated. It is helped by the serratus anterior muscle and the trapezius muscle. The nerve supply of the trapezius muscle come from the spinal part of accessory nerve, but the proprioceptive, this is a motor supply of this muscle, whereas the proprioceptive fibers, it is taken by the ventral primary rami of C3 and C4. So the next muscle which I am gonna discuss is the latissimus dorsi muscle. As the name suggests, latissimus means wide and dorsi means in the back region. So it is a wide muscle which is present in the back region. This is actually the one half shown. The other half is on the other side. This is a triangular muscle. It is originating from the lower 6 thoracic vertebra, that is from the T7 to T12. Lower 6 thoracic vertebra, its spinous process. Lower down, it is attached to the posterior lamina of the thoracolumbar fascia. Posterior lamina. To the lumbar as well as the sacral vertebra, spinous process indirectly, because between them there is a thoracolumbar fascia posterior lamina. So it is indirectly attached to the spinous process of lumbar as well as the sacral vertebra. That is here. This is actually the iliac crest, posterior part. So it is also giving origin from here. The muscle also take its origin from the lower 3 to 4 ribs as a fleshy origin. It also originates from the inferior angle of the scapula. Here we have the inferior angle. This is actually the inferior angle of the scapula. The insertion of this muscle is, so these are the horizontal fibers. The upper fibers are more horizontal, whereas the lower fibers are more vertical. And it go and inserted into, this is the humerus. So in front of the humerus there is the bicipital groove. So in the floor of the bicipital groove, it is getting inserted. There is one more muscle which is here, that is a teres major, and this teres major as well as this latissimus dorsi, they will form the posterior axillary fold. Now talking about its action, this muscle will help in adduction. It also help in the medial rotation. So this is the medial rotation. It also help in extension, that is movement of the hand like this. So this muscle, it is also involved in the forceful expiration. For example, coughing, because the expiration is normally a passive process. In forceful expiration, this muscle can also be involved. This will also help during your climbing. So when you are climbing a tree, it will raise the body towards your arm. Its nerve supply come from thoracodorsal nerve. So it is thoracodorsal nerve. It is coming from the posterior cord of the brachial plexus. So brachial plexus I will be dealing detail in another video. So now let me stress that it is coming from the thoracodorsal nerve, root value C6 to C8. So the next muscle which I am gonna talk about is about the pectoralis major muscle. It is having two heads, that is a clavicular head as well as the sternocostal head. So this is a clavicular head and this is the sternocostal head. So the clavicular head is originating from the medial half of the clavicle, its anterior part. It is originating from the medial half of the clavicle. This is the clavicle bone. The sternocostal part is originating from the lateral half, anterior part of the sternum at the level of 6th costal cartilage. So this is the 6th costal cartilage and this is the sternum. It also originates from the 2nd to 6th costal cartilage. 6th costal cartilage. It is also originating from this. So this is the aponeurosis of the external oblique muscle. So this muscle, that is the external oblique muscle. So this is the aponeurosis of the external oblique muscle. The pectoralis major muscle also take origin from here. So this is the humerus from the front view, and this is the intertubercular groove, because this is a greater tubercle as well as this is a lesser tubercle, and this is the intertubercular groove, otherwise called as bicipital groove, because bicipital groove, because the tendon of the long head of the biceps pass through it. So laterally we have the lateral lip of the bicipital groove, and medially we have the medial lip of the bicipital groove. So here you can see this is the pectoralis major. It is attaching at the lateral lip of the bicipital groove, pectoralis major muscle. You can remember like this: PLT, from lateral to medial. So these are the insertion of the pectoralis major muscle at the lateral lip. In the floor it is the latissimus dorsi muscle, and in the medial lip it is the teres major muscle. This one you can see, it is teres major muscle. So one more thing to note is that this is a clavicular fibers which is forming the anterior lamina, whereas the sternocostal fibers, so they will form the posterior lamina. Here you can see the fibers originating from the higher aspect are going slightly down, whereas the fibers originating from the lower aspect is going slightly up. So this two lamina of the pectoralis major, it forms the anterior axillary fold. So the action of the pectoralis major muscle is, as these fibers are arranged like this, it will help in adduction, and the clavicular fibers, as they are arranged in front, it will help in flexion. As this is attached to the anterior to the shaft of humerus, it will help in the medial rotation of the humerus. So the nerve supply to the pectoralis major is the lateral pectoral nerve, which pierces the clavipectoral fascia to reach the muscle, and the pectoralis major is also supplied by the medial pectoral nerve. This medial pectoral nerve will also supply the pectoralis minor muscle. There is a pectoralis minor muscle as well as major muscle. The lateral pectoral nerve is coming from the lateral cord of the brachial plexus, whereas the medial pectoral nerve is coming from the medial cord of the brachial plexus. So one applied here is the Poland syndrome. So when the pectoralis major muscles are congenitally absent, as you can see right here, especially the sternocostal fibers, when they are during birth, when they are absent, that syndrome is called the Poland syndrome, and it will look like this. So the next muscle which I am gonna discuss is about the pectoralis minor muscle. So this is the pectoralis minor muscle. It is a triangular shaped muscle. Actually it is taking origin from the 3rd, 4th, 5th ribs. It is actually present deep to the pectoralis major muscle. You can see this is the pectoralis major muscle. So it is present deep to the pectoralis major muscle. And this tendon of the pectoralis minor muscle, it is going and attaching to the medial border of the coracoid process. So this is a coracoid process. So this pectoralis minor muscle is helping for the protraction of the scapula. Protraction of the scapula along with the serratus anterior muscle, which is also called as boxing muscle or the punching muscle. So as it is attaching to the coracoid process like this, it will help in depression of the scapula. The depression of scapula. Moreover, this muscle, it is accessory inspiratory muscle. That is, it will help in forceful inspiration. So it is supplied by the medial pectoral nerve. In some cases, when this is the pectoralis minor muscle, the upper fibers of the pectoralis minor muscle, it comes from the first rib and attached to the coracoid process. From first rib and attached to coracoid process. In that case, this small muscle, it is called as pectoralis minimus muscle. Minimus muscle. So the next muscle to discuss is about the serratus anterior muscle, that is this muscle. So these are the digitations of the serratus anterior muscle. So actually there are 8 to 10 digitation of the serratus anterior muscle. So the first digitation originates from the first two rib, whereas the rest all digitations are arising from the corresponding rib. Okay. So after originating, it goes laterally as well as posteriorly, and it is inserting into the costal surface of the medial border of the scapula. So this is a view when you are looking from your front. So this is the costal surface and the medial border of the scapula. The serratus anterior muscle is attaching. So this is a superior angle of the scapula. The first two digitations, 1 and 2 digitations, is inserting here, whereas the third and fourth digitation, it is inserting at the medial border of the scapula, whereas the lower digitations, it is inserting at the inferior angle of the scapula. Inferior angle of the scapula. This serratus anterior muscle, it is called as a boxing muscle because it is used for punching or pushing. So this muscle will help in the protraction of the scapula along with the pectoralis minor muscle. As it is inserted into the medial border of the scapula, it keeps the medial border along with the chest wall.